Today, I have as my guest Dr. Julian Kenyon of the Dove Clinic near Winchester, I think it's Twyford in the UK, who's made himself actually Britain's expert on GI tract analysis, on fecal microbiome transplant, and later he's going to tell you about his new creation, gut flora replacement therapy, or GFRT. As usual on this show, we're going to answer your questions, not ours, but we have never had a show so popular. So you'll have to bear with me because we had over 50 questions and we've got time for about 20 unless we have part 2 next week. Anyway, good morning, Julian.
Good morning.
I hear you're in the middle of a hurricane, is that right?
But coming over from the Atlantic, and hopefully I won't lose Wi-Fi during this. Sometimes it goes. I guess right, we're out of sticks here, you know.
Well, let me tell you about the questions. A few were addressed to me, and in fact, about 50% were addressed to me, and 50% were addressed to you. But in fact, I've handed a lot of my questions over to you. So we'll make you the focal point today. All right. At the end of this show, for everybody who's listening, I'm going to talk about Julian's email address, the Dove Clinic's email address, his phone number. So if you're interested, you'll have all the details, and we'll even put it on screen. So here we go, Julian. This one's from Carrie Creswell, the first question. I've just been put on antibiotics for cellulitis following a bee sting, hand progressing up wrist. What should I do to help the gut flora during the 10 days of antibiotics? And probably more importantly, what should I do to build the microbiome back up afterwards?
Right, a broad spectrum probiotic and a prebiotic. A very varied diet. Try the 50 foods challenge. Have as many different foods as you can during the week, and lots of fermented products, sauerkraut, kimchi, kefir, and so on and so forth. But could I just make a comment? Look, we keep bees. I get stung all the time. Cellulitis following bee stings is rare, and you've had 10 days of antibiotics. You've had double the amount. So there's something else going on in your case, and I don't know what it is.
I agree. Do you think you can help the gut flora under the onslaught of drugs and antibiotics? I get asked this question all the time. So people having chemo, can you really do anything about it, or do you just have to sort of wait and live with it?
Yeah, we can do something about it, and we've got proof of that because we've done nearly 200 gut flora mapping, gut microbiome mapping tests. And we know we can do that effectively. We've actually got proper tests and so on, yes.
So people should still carry on taking the prebiotics and probiotics during that time?
They should, most definitely.
Okay. I've got one here from Samuel McBride. It's another version of the same question, really. I've had so many courses of antibiotics over the years, sometimes of multiple varieties, trying to find one that works. What hope is there for recovery from my gut microbiome? I always have eaten healthily and lots of veg and whole foods. Again, this is the sort of question we get quite often, but frankly, these antibiotics should have worked. You should have found something to have worked by now. So I worry that something else is going on here, but let's just say there's good news and there's bad news for you. Be very clear, there's very clear research that if you just take 5 days of antibiotics, you can render certain strains of certain bacteria extinct. That's it, they've gone. And people, I don't think, realize, doctors included, how bad the damage can be from drugs and antibiotics. So an example came in recently. It was about stem cell transplants. Nothing to do with stem cell transplant. It was actually the 4 rounds of 2 drugs that people had first. And then they had the stem cell transplant in America. 1 year later, if left to their own devices, these people only had 27% of their microbiome. So that's the bad news. The good news, and this is totally subjective, although Julian's got all the answers and the facts. I had antibiotics for the first 32 years of my life. And since then, I've always eaten a Mediterranean diet full of prebiotic foods like soluble fiber, olive oil, fish oils, elagitannins in berries and things like that. And I exercise because there's research I exercise every day. There's research on the fact that exercise will improve your microbiome. I acidify my gut because you need an acid gut. You need alkaline mitochondria, but you need an acid gut. And I acidify my gut with lemon juice and apple cider vinegar and things like that. I eat unpasteurized cheese, always have done. I take kefir. I've now got a nice little man in the town who's making me kombucha. So I would say I'm 71, I'm completely healthy, so it can be done. Big point. Do you want it done quickly or do you want it done slowly? And I think that is the major issue. It's taken me best part of 40 years to get back to where I am. Nowadays, you can talk to Julian and get it fixed in 40 minutes, I would think. How long? Anyway, here's one for Julian. Carol Barton says, I have a stoma, and although I'm doing very well with my cancer, I have chronic constipation. The stoma is on my right side and my stomach hurts and is bloated. I eat a lot of fiber, but I'm told it's still caused by an imbalance of gut flora. So how would you correct constipation naturally?
There's a whole range of different natural medications we can use. You need your microbiome mapping. There's something wrong with it. If you've got a stoma, you've probably had a colorectal cancer. The most common cancers, the most common abnormality in the microbiome in all the cancers is colorectal cancer. And so we need to get digging a bit deeper on that. And so your question is quite complex, and it involves details which are about you, which we don't actually know just at the moment.
Do you think, you and I have talked about this, and I think it's a really interesting comment. Do you think that people who get colorectal cancer, do you think the first thing they should do is have a fecal microbiome transplant and correct it all?
Yes, absolutely, no question. No question.
Yeah, so do I. I think, I'm sure you're the same, but I get to see people after they've had the operation or after they've had the first round of drugs or something like this. And by that point, they're on the sort of steady downward slope because they're actually compounding the problems in the gut, I think.
Yeah.
I've got a question here from Mike Hall in Edinburgh. I understand that a newborn child receives the quality of its microbiome from mum just prior to birth. If true, the quality of the mother's own health, the microbiome, is crucial in transferring a sound gut health immediately to the newborn infant. Is that true? Yes, it is, totally. Baby receives its early microbiome from its mother, actually in the womb, although they always thought it was sterile, from the passage through the birth canal, from mother's breast milk, so they all add up. Vaginal birth babies, there's some new research out, actually have a microbiome that's very similar to mum's, whereas cesarean babies have a microbiome that's picked up from the hospital ward, can you believe? Then the University of Arizona, I think it was, they did some research and they showed that passing through the birth canal, baby can pick up 200 to 300 types of bacteria. So some are going to be good, some are going to be bad. And there's a lot of research on this from Africa. And women who are very, very healthy in Africa have a vagina full of lactobacillus, which is exactly what baby needs. Whereas stress mums have stress bacteria. There's research on mothers with group B strep giving it to the babies. There's research on mothers who use drugs who are alcoholics, causing birth defects in babies and lifelong problems for babies. So, yep, it's absolutely true. Next one, for Julian, Tina Fox of Telford. I had food poisoning on holiday in Corfu 38 years ago. Could this have led to me developing IBS a few years later?
A very simple answer, yes. When you get details of my papers, one of my papers in the Human Microbiome Journal directly addresses this, and we've had some excellent results, and people who've had IBS for longer than 38 years, 40 years plus, ruin their lives.
I've got one here from Hazel near Basingstoke. She says, given the gut-brain axis, should an elderly person in their 80s who has started showing signs of dementia, but also started to have a lot of more gas, start a gut intervention program? Again, I think the answer is yes. We know Alzheimer's starts in the gut. Only drug companies seem to think it starts in the brain. There are several good studies now showing that, I call them handkerchiefs, but they're actually called curly fibrils. They're produced by bacteria and they stick together and form these handkerchiefs in the gut. The immune system comes out to attack them, but the immune system can't attack just locally. It has to attack all over the place, so it attacks the myeloid plaque in the brains. And that's one of the biggest issues. We've also got research from Toronto, and they show that things like resveratrol, actually, which is linked to sirtuin-1, that actually limits inflammation in the body. Well, that's what the gut bacteria, a decent set of gut bacteria will do, limit your inflammation. So we've even got research, I think, from mice. In Sweden, they knocked out all the bacteria in the mice. So there were no bacteria, and the mice never got Alzheimer's. As soon as they had a normal set of bacteria with an infection, bingo, they got Alzheimer's. So something you like to say on that, Julian?
Yeah, I'm currently writing up 2 cases as an observational study of Alzheimer's in which we replaced the gut flora, and have had some simply extraordinary results. Yes, it's a very interesting thing. By the way, the mice with Alzheimer's, they put their head through the hole and they put their head from side to side and say, where's the cheese? If they haven't got Alzheimer's, they go straight for the cheese.
Lovely, lovely. But, you know, at the end of the day, Hippocrates said all illness starts in the gut 3,500 years ago. So this is what happens. You lose the good and the bad guys come out to play. Here's one for you, Julian. Terry Bridgman of North Devon. I have been diagnosed celiac for 15 years. After reading Chris's book, Heal Your Gut, Heal Your Body, I'm determined to fix this. What are your thoughts on both the kefir and sauerkraut for not only gut health, but repair also?
The kefir and sauerkraut, you're doing exactly the right thing. You can't cure gluten enteropathy, unfortunately, because it's a type 1 allergy. And so you'll be able to help to some extent, but you won't completely clear it. So there's not a lot I can do about that, apart from advise you on gut health. And we could map your gut microbiome, see what it looks like. We'd have some suggestions, but it won't cure it.
What about the idea of repairing your gut lining? Do you think that's possible, or do you just go straight for the gut bacteria and in the end it gets repaired?
Yeah, you go straight for the gut bacteria and in the end it gets repaired. And that's the way it goes, yeah.
Yeah, we use, what do you think of this? We use unpasteurized cheese because by and large, mum gave baby not just loads of bacteria, but she gave baby immunoglobulins. And there's research showing the immunoglobulins talk to bacteroidetes and say, line the gut. Would that not help, surely?
Yeah, it would. And in terms of cheeses, the artisan cheeses are the things to go for because they're alive, they're full of bacteria. The French are better at artisan cheeses than the British. But to go for French artisan cheeses, they're absolutely great. I have to say, I'm very partial to them.
Well, because having had a house in the south of France for 30 years, we've actually now monopoly of supplying the little Thai guy in town. So I've got all the raw cheese I could want. Here's another one for you from Helen. She says, if your gut health is good, should you expect to see things like fungal toenails start to grow through clear? If so, would you do a second round of a general protocol if you hadn't seen signs of improvement after the first 3 months? Or would you ramp it up in some way?
I would expect the toenails to come through clear. If they don't, then what I'd do in your case, I'd map your microbiome to see what's going on and then work things out from there.
Do you think 3 months is a reasonable period to clear a toenail? I would have thought it needed to be longer. I mean, just because the toenail takes longer to grow.
6 months.
6 months, okay. Here's another one. This is John Stokes near Oxford. If having a full fecal transplant, is it genetically important to implant male-sourced gut flora into male guts and female into females?
No, it's not. Bacteria are asexual, so they're a lot less complicated than we are.
I was going to say there's research from America. I mean, there was a doctor in Rhode Island, Dr. Colleen Kelly, and she made inroads on Clostridium difficile in her hospital, and they made her do clinical trials and everything because she took a girl who had very bad Clostridium difficile and was going to the loo 20 plus times a day. And she ended up, this girl was about 23, she ended up taking the feces from the girl's healthy boyfriend and putting him into the girl. So girl to boy, boy to girl, no problem. She had very good research, by the way, on her fecal microbiome transplant. I'm sure Julian knows. Here's one for you, Julian. This is from Eileen and Neil. I have thyroid cancer, which has metastasized to my bones and liver. And I just had a 5-day course of antibiotics after a gallbladder removal. What's the best way to restore my gut bacteria? Because you've got a cancer, the answer to that question is very complex and very personal to you. The only way of doing that is mapping your microbiome, and because your microbiome will be abnormal, I'm pretty certain about that. So we have to work out what's going on in you. Yeah, I mean, I agree with that totally, because gallbladder removal, gallstones, almost certainly they've got high fat. So there's another complication going on there. And there's a lot of research in terms of thyroid cancer and things like Hashimoto's, which all comes from the gut. So I think there's clearly a gut issue here, but it's very, very complex, the question. And I think Julian's absolutely right. Do you think gut mapping for the medical profession in Britain is a long way off, Julian?
Yes, I do. My first paper in the human microbiome was about gut mapping, hoping people would begin to take it up. The average doctor knows nothing about it. Very, very interesting. In this journal, Human Microbiome Journal, they have a rank order. They rank order their papers over a 2-year period, and they call it plum metric. And there's lots of papers from institutions and professor this, professor that, professor whatever. I come in the top 3, so that gives me hope that somebody's taking notice of this.
I notice. I mean, I deal with a lot of people in America now, and Americans, I think, because of the microbiome project, you know, there were 40 top medical schools involved in the microbiome project, and I think a lot of oncologists really do understand all about it. Well, not all about it, but they know about it in America. And in Britain, I still get nurses, oncologists saying to my patients, it's all a load of mumbo jumbo, you know.
Or something else.
Yes. Yeah, that's right. I think we're a long way behind and falling even worse. I've got a question from Christopher Drury for me. I'm having to take doxycycline as an anti-cancer drug. Someone's twisted his arm. What effect will this have on my good gut bacteria over the long term? You have touched my pet subject. Jane McClellan wouldn't let me put my research on her site. I'm fed up with hearing about doxycycline for a variety of reasons. There is actually not a great amount of research on doxycycline dealing with cancer stem cells. A Professor Lisanti, who is an American, actually working in Salford, he did research where he used doxycycline in a test tube in a petri dish, and he used it on cancer stem cells. And he killed about half of them. And then he had a month off, and then he put the dose up 50% and killed another half of the half. And then he put the dose up to 100% and killed virtually all of them, leaving the rest as ordinary cancer cells at most, jelly otherwise. And so you've got to understand that's what he did. And people using doxycycline don't do that because it would probably, I don't know, damage them infinitely. So the question really is, would I take an antibiotic to heal my cancer? No, I wouldn't. There's lots of ways of attacking cancer stem cells. And if you look at the gut microbiome project, the human microbiome project, it said very, very clearly, your gut gets ill first, then you get ill. You can't get better till your gut gets better. Now, I've heard people say, well, take the antibiotics, get yourself right, and then you'll be all right. You can fix your gut afterwards. I think that is incredibly risky. I don't even think it's possible. By the way, there are natural compounds like azelaic acid, lycopene, turmeric, EGCG, feverfew, piperine, sulforaphanes. They're all on my website. They'll tell you how to deal with, chuck those at your cancer stem cells, but I wouldn't take doxycycline. What about you? Have I stepped on your toes, Julian, or do you agree?
No, I agree with all of that completely.
There you go. So I've got another question here from Dan Cook. I have a 24-year-old daughter who was hospitalized with ulcerative colitis. Conventional medicine says they can do nothing for her. She is on an 8-week steroid course and then a omeprazole for life. I'm sorry I'm laughing, but I mean, they say they can do nothing for her and then they give her a steroid course and omeprazole. Really brilliant. She is taking aloe vera and slippery elm, but her steroid course still has 2 weeks to run. She also has psoriasis. Do you have any suggestions, Julian?
Yeah, you need gut flora replacement without any question, and mapping the gut microbiome. That's the thing to do.
I just love it. Conventional medicine says there's no drugs that can do anything, so they give her 2. And not only they give her 2, they give her 2 steroids put up COX-2, which causes inflammation all over the body. And omeprazole, one of the worst drugs for actually destroying gut bacteria. So they've really put the boat out. Chris, from Paul O'Connor. I'm interested in knowing how volatile the gut microbiome is. If I took 5 tests a week apart, varying my diet, would I have 5 vastly different results? Is diagnosis only as good as the last sample? I'm going to answer this question, but I'm sure Julian have lots to say on this. If a bacteria is extinct, as I told you they can be early on, for example, lactobacillus is almost non-existent in women with breast cancer, I think you're going to have the same result week in, week out. But if you were somebody else and you had small amounts of lactobacillus, small amounts of bifido, then we know changing your diet, eating lots of pectins, can put your lactobacillus up, eating lots of inulins, garlic, onions, and so on, will put your bifidobacteria up. So it would change, but in principle, I would think the whole thing stays the same. So I would say one more thing that we've just discovered from research. If consistency, if you did do it 5 times and consistency was all over the place, I think it would mean you've got something very nasty in there, particularly a parasite. Okay, Julian, correct all that.
Yeah. I mean, look, basically a 16S RNA gut microbiome test is reliable. There's some variation, but if you take one blood sample, split it in 2, send it to 2 different laboratories, the differences can be 15%, and that's standard. So the diagnosis is basically as is given by the 16S test. It's not just the last sample.
I've got a question here for Julian, but I'm going to add something to it. It's from Alan Armstrong, but there's one also from Helen again in Hampshire. She's not related to you, is she, Julian? Helen in Hampshire?
No.
Are there any reliable tests to establish the current condition of one's gut? First question. And secondly, do you use GI map as one of your tests? If so, what can it tell us and what are its limitations? If not, what would you use instead and why, please? I think it's time to explain what you do, Julian.
Yeah. Don't use the GeoMap. It'll tell you nothing that's of any use. Many nutritionists use that. It's not the standard scientific test. The standard scientific test is a 16S RNA test, and that's shown in one of my human microbiome papers, and that's the standard, scientific standard across the world. That's the one you should use.
I've seen people turn up to me with different tests, I won't name any, and they're all vastly different. Why would that be?
Because most of them are GI maps, basically, and or they're from doctors' data, and they're unreliable. They're not 16S RNA tests.
So let me get it straight. A GI map that looks at the bugs that you've got in there is not going to be anything like as accurate as one that looks at the RNA that's in there.
Yes, correct. Yeah, yeah. I mean, that's the standard scientific conclusion worldwide. Yes.
Yeah. Okay. Did you know that at any one time, 38% of the small molecules in your bloodstream come from them, not you? I think that's it all, doesn't it? Don't you think that says it all? I mean, their microRNA, they make 3 times more microRNA at least than you do, and so they can trump. Am I allowed to say that word these days? They can trump your microRNA without any trouble at all.
Yeah.
I've got a question here from Amanda Brennan. I plan to have fecal analysis. How do you decide whether to use supplements or a fecal transplant to correct gut problems? Okay, it's for me. It's about reality, Amanda. What's your timetable and how much damage has been caused? So I often say to people, look, you've got 2 options. If I think there's a lot of damage there, I'll say that there's 2 options. 1, yes, I can do things, but 2, there's a fecal microbiome transplant. So we'll come to that. The latter is much, much quicker. So that's the question about timetable. I mean, some people have had it going on for years, in which case just go for the FMT. So that's what the big issue, timetable. But the other one is damage. Really, I get people who have had food poisoning 6 times. I'm sure you get it, Julian. And they've had yeast problems for 30 years or more, and so on. I would prefer to get rid of a parasite first because they are so damaging on the microbiome. There's been research about it recently. But otherwise, if it's severe damage, or if you've lost members of the gut, I would hand them straight over to Julian.
Yeah, okay. Yeah.
Perfect. We haven't rehearsed, I promise. Right, for Julian, this is Cherith Adams from Lancaster. My gut health has got worse over the years. It was damaged by 2 severe viruses. My main problem is a terrible lack of stomach acid. I take betaine hydrochloride to help with that, and I don't think I would survive without it. But I still only just manage. Do you know anything else which helps the stomach part of the digestive tract?
Yeah, first of all, betaine hydrochloride works, yes. The answer is, in your case, you've probably got a chronic fatigue syndrome, and almost certainly we'd need to map your microbiome, and you would need gut flora replacement. That in turn would sort out the stomach acid.
How common in the stomach is something like Helicobacter pylori?
I'll have to look up the research. I don't know, but I haven't got a percentage.
Yeah, I mean, we seem to get a lot of it in acid reflux. If we get people with esophageal cancer, for example, a lot of them have actually had Helicobacter pylori at some point in their lives.
Yes, yeah, I agree.
Okay, Julie again, Doreen Lee. The Mayo Clinic has found that the use of antihistamines to treat stomach acid can produce Clostridium difficile infection in some people. Is it possible that there can be the same result, i.e. diarrhea, without Clostridium difficile being present, having been prescribed high-dose antihistamines to treat pruritus?
Pruritus, itching.
Pruritus. I'm not a doctor. I don't pretend to be.
Okay. Yeah. I don't use antihistamines for stomach acid, frankly, and so you can get diarrhea without C. difficile. Yes, If you take high doses of antihistamines, that could possibly give you diarrhea. Yeah.
Clostridium difficile, I was looking at the Colleen Kelly research a few years back, and they were talking then, probably 6 years ago, about 14,000 people in America going to hospital a year and dying from Clostridium difficile just because they had antibiotics. Incredible figure, isn't it?
Yeah.
I've got one here for me. This is from Alison Dutton in Chester. I'm on the methotrexate for rheumatoid arthritis. Rheumatoid arthritis is all about the gut. I have your book, Chris, and try to follow your gut health dietary advice as best as possible, and wonder how I can confirm it if I have a parasite which I may need to treat. Right, I know a bit about parasites. I've had 4 of them in my life. But why I'm laughing is because actually the first time I ever was ill, I went to my doctor, because I was in advertising in those days, and he sent me to Harley Street's Finest and so on. And nobody during all the tests mentioned the word parasite. And afterwards I asked a doctor, why does nobody mention the word parasite? Because I had one. And that was what was causing all the problems. And at the time they said, well, doctors get 6 guesses. So they do a sample of your feces, send it off to the lab, and they have to write down their 6 guesses. And if it comes back negative, then it could just be that they guessed wrong. So they don't like to do it. So they didn't mention a parasite at all. And I literally had all the tests, and then I had them again because they couldn't find what was wrong with me. So that's the background to that. You can do a test, GI map, I'm sure we'll be talking about, but why spend the money and take time? Almost all parasites can be knocked on the head in 25 days by myparafree and artemisinin as a double act. If they've laid eggs, then you need another 25 days. What do you think, Julian?
Yeah, that's absolutely correct. By the way, parasites, don't get it them out of perspective. The well over 50% of the world, especially in hot countries, all have parasites. They live with them. They have chronic parasitic infestations. They have a lower incidence of allergies. Now, there's a treatment which is proven where with people who are allergic, you give them a pig parasite eggs, which is only pathogenic in pigs, called Trichuris suis. You give them that, and the Trichuris suis hatches in these allergic patients' guts, and then their allergies improve. Yeah. So you know, in the hot parts of the world, look, if it's hot and wet, you're going to get more parasites. Of course you are.
Yeah. I was helping a son and daughter. Their mum had bile duct cancer in India, and after about 10 minutes, I said, "Do you know, I'm sure she's got a parasite." And they went, "Everybody's got a parasite in this town, because we all eat the fish from the river, and the fish have all got parasites."
Yeah,
but quite interesting with bile duct cancer, no British doctor ever thinks there might be a liver fluke. And liver fluke are very big on liver problems and bile duct problems.
Yeah, but they're commoner in hot countries.
Yes, well, she did in this case, but well, I live in Thailand at the moment, and liver fluke are quite a big thing out here. But you know, how many people go on holiday to Cambodia, Thailand, Singapore, or whatever, and could pick one up? That little dose of food poisoning when you were on holiday. For Julian and Chris, but I'll let you go. Christine Bradfield in Adelaide, Australia. What is your view on cancer patients who are undergoing chemotherapy having fecal transplants? So this is having a fecal transplant during your chemotherapy.
I think that's a very good idea and very sensible, because your innate and acquired immunity lie in your gut microbiome. That's your protection against cancer. You get much less side effects of the chemotherapy if you do that, and it's harmless to do. Yes.
Did you see there was research about 2 weeks ago on people having fecal microbiome transplants during immunotherapy?
Yeah, and that's really important, because the current favorite of immunotherapy is what we call checkpoint inhibitors. If you've got an abnormal microbiome, then they can cause life-threatening autoimmune disease, particularly Crohn's disease. And so, but if you get the microbiome right first, then the checkpoint inhibitors are more likely to work. And this is cancer immunotherapy.
Well, in fact, there's been a build-up of research over the last 2 or 3 years, because basically the checkpoint inhibitors work on blockages on the T cells, and they've shown that taking probiotics, there's been about 5 studies for and 1 against, eating lots of soluble fiber, or now having a fecal microbiome transplant, all put the T cells up, make the immunotherapy work better. It's not kind of rocket science, guys. So I find that quite interesting. But can I just ask a question? Really, if someone was having 12 weeks of chemotherapy, would you say to have a fecal microbiome transplant during the chemo or immediately afterwards?
I'd prefer to do it first, before. That would be my preference. But if all else fails, then we can do it during.
All right. Why would you prefer to do it before? Because the chemo is going to wipe out loads of the good guys you just put in.
Yeah, because the chemo will wipe out much less if you do it before. It'll protect against the downsides of chemo. Really?
So you've actually found in your researches that the good bacteria get wiped out less, do they, than the bad guys?
Yeah.
I've learned something today. It's a very interesting point. I always say, and I think this is really important, doctors tend to give, let's say it's a lady with breast cancer, she has her FECT or whatever, she has her radiotherapy, somewhere in there she has a bit of surgery, and then the doctors go, well, that's it, then see you in a few years' time, once a year test and so on, as if it's all over. I always say to people who've been through the mill like that, right, now it's time to start. Now it's time to rebuild you. Now it's time to sort your gut out and get your bacteria back where they should have been in the first place. Would you agree with that?
Yeah, I would.
Right, here we go with Bernadette Marketus in Malaga, Spain. I have a 30-year history of duodenal ulcers. And 3 years ago, I was diagnosed with mantle cell lymphoma in the duodenum. I had a PP with Chris, personal prescription. I follow his gut health protocol, and I follow a lot of his other advice. At the time, Chris suggested a fecal transplant, but I couldn't get my head around it. One of the things that bothers me is if the sample put inside me carried some infection, disease, or genetic material, and my problems increased. Is it possible my ulcers and lymphoma can be cured by treating my gut health by using Dr. Kenyon's new methods?
Be cured. Mantle cell lymphoma is challenging. It's difficult to treat. Your microbiome is likely to be abnormal. Part of the treatment process would be to do the standard thing, map your gut microbiome. Almost certainly in your case, you'd need gut flora transplantation, and that would help everything else work. So look, I'm not curing the whole world, but we're cooperating with conventional treatment approaches largely.
It was, correct me if I'm wrong, it was one of the issues about a year or so ago with fecal microbiome transplants, that they made the donors tick all the boxes, but hadn't done so for, if you like, psychological issues rather than practical ones. And there were a very few people I know getting sort of depression and things like this after their fecal microbiome transplant. Is that something you found? Is that why one of the reasons you switched?
No, I mean, I've never come across that. The reason we switched was because of the COVID-19 outbreak.
Yeah.
Because I'm in touch with the academic community in gut and all the rest of it. I had some pre-publication data sent from researchers in Hong Kong, whereas people had been infected with stools with COVID-19 in, and then they got when they did transplants, and then they got COVID-19. What that therefore means is using donor-derived implants is no longer safe. And this is a silver lining, because we then developed gut flora replacement therapy, which is not foreign. It is all different species of bacteria which are passed for human use and don't carry that risk at all. Plus the fact it's massively cheaper than donor-derived implants. It's less than half the price, massively cheaper.
So how much was a full-blown fecal microbiome transplant?
5,500, and this costs £1,800, including a mapping test done after the gut flora transplantation has been finished. So it's just hugely cheaper.
All right. So tell me about your new creation. Tell me what you actually do.
Yeah. We put in
what you'd give people, so on.
We put in large amounts of specially chosen lactobacilli, bifidobacteria, E. fecium, and most importantly, butyrate, which is a very important small chain fatty acid. By the way, butyrate smells really bad. But in the transplantation room, we have fresh air sprays and all the rest of it, and we're getting very, very good results without any downside.
So to explain it to people simply, it's like an extremely high dose, trillions of lactobacillus strains and bifidobacteria strains.
Yeah, and they're put directly up into the colon. It's very easily done. It takes about an hour and 20 minutes, and then the patient can go home. We do that on 10 different occasions, preferably 5 one week, 5 the next, but we can split it 2, 2, 2, and 4 in different weeks. It depends on what's convenient for the patient.
Okay, I should explain to everybody, butyrate is actually a compound naturally produced by certain gut bacteria if you're healthy. And butyrate, one of its benefits is it actually kills colorectal cancer cells. So it's actually part of the body's first defense, because, you know, I'm sure because that cauldron of bacteria in our gut goes wrong every now and again, we're very prone to getting minor skirmishes with colorectal cancer. And sodium butyrate defends us all the time. That would be fair, wouldn't it?
Yes, it is. Absolutely. Totally. Okay.
Well, actually, we've just answered Julie Jones's question. She said, are you still able to perform fecal microbiome transplants during the COVID pandemic? So the answer is no.
We do it in a modified form. By the way, sewage companies throughout UK are monitoring COVID-19 outbreaks by measuring the amount of COVID-19 in the stool of the different areas. And so therefore, at the moment in the north of England, there's a lot more COVID-19, and the COVID-19 in the sewage is very high there. It's very low in the south of England. It's all the water companies, the sewage companies are doing that.
Crumbs. Are they going to get rid of it very easily?
Ish. I'd have to talk to the water companies.
I was going to say, does that mean you actually, in somewhere like Thames, where you're drinking recycled water, you could actually get COVID?
Yeah. I'd have to inquire from the scientific officers of a relevant water company. So
I like putting my guests on the spot, Julian.
Yeah. Well, at least I'm honest. If I don't know, I'll tell you.
Okay, last question. Anne Cullen of London. So far, fecal transplants have had limited applications. I think that's legal limited applications, isn't it? Would Dr. Kenyon's alternative be appropriate for a wider range of health problems? I'm particularly interested in ovarian cancer and rheumatoid inflammatory arthritis.
The answer is definitely yes. Those two conditions are important, especially ovarian cancer, top of the list. We need get mapping and then get the gut flora replaced. Yes, absolutely.
Right, we've come to the end of the questions. So we've been at this about 45 minutes. It's important for me to tell all the people who were listening that they can get hold of you at juliankenyon.com. They can actually find out about gut flora replacement therapy, GFRT, if they go to doveclinic.com. And if they want to get hold of you, you're +441 962 718-000. That's +44 1962 718-000. So is there anything you'd like to add to all of this, Julian?
Not really. I think we've said everything. Incidentally, there's quite a lot of people I manage at a distance by telephone consultations, email, and we can send the kit for gut flora replacement. And we can do that. I've been doing that with some patients in Australia very successfully. So if they're not too bad, we can do it all remotely. But most of the issues raised here are reasonably serious.
So let me get it straight. So if someone from Australia contacts you, you can do what? You could send them the ability to do GI analysis and
to do a 16S RNA test and to do a telephone consultation, talk about the history and all the rest of it. And so I get a general idea of what's going on. When I get the results of the test back, that combined with the history and all the rest of it, I can tell very quickly whether they're going to be able to correct it using all the dietary approaches, oral probiotics, prebiotics, or whether they're going to need gut flora transplantation. Because I've done so many of these tests, several hundred, and so I'm very experienced in that area. And so there's a collection of people. We've done it at any part of the world just by this kind of contact.
Okay. All right. Well, I hope our listeners have enjoyed that. Thank you very much, Julian. It's been extremely interesting. In a month's time, we're going to be talking about off-label drugs. It's part 2 of the 2-part session. And we've got Professor Dana Flavin joining Julian as well. So we've got 2 experts on off-label drugs. I think they'll probably say a bit more than I said. My view was don't try this at home. So anyway, thank you very much for listening. Thank you very much, Julian, and we'll see you next time. Bye.
Bless you. Bye-bye.